Hi, my name is Harshpal Singh. I'm a neurosurgeon here at Premier Brain and Spine. So I grew up in Atlanta, Georgia. I went to the University of Georgia for undergraduate when I was part of the honors program. After that, I attended the Medical College of Georgia, where I received my medical degree. After that, I was accepted into the prestigious neurosurgery residency at the Mount Sinai School of Medicine in Manhattan. After completing my residency, I did a fellowship at the University of Miami, where we concentrated on complex spinal cases, spinal cord injury, as well as minimally invasive surgery. I grew up always wanting to be a doctor, particularly a surgeon. My initial interest was in cardiothoracic surgery, but during medical school I was able to rotate through neurosurgery and I just fell in love. The first time I did a craniotomy, to see a brain pulsate, and to see how delicate and complex and how careful you had to be in order to get an optimal outcome, just drew me to the profession. So as a neurosurgeon, we treat a wide variety of diseases, but we also treat a wide variety of age ranges. Adult idiopathic scoliosis can happen when somebody who's in their late teens, early 20s, and they typically don't need surgery till they get to a point where they can't function. I also operate on people who are in their 70s and 80s, who have been great their entire life, but all of a sudden, in the last few months, who are non-functional and who are not able to participate or enjoy the daily activities of life. So again, as a neurosurgeon, I'm lucky to treat a wide variety of diseases, but I also treat a wide variety of patient ages. And we take care of everything at Premier Brain and Spine. I've had the benefit and blessing to have trained with some of the best surgeons in the world. I have trained with super complicated deformity surgeons who are very talented, who I was able to learn and develop my own skill set with. But most of the patients I see don't have a major scoliotic deformity. They don't need a major surgery. But having the experience and the exposure and the knowledge and the wherewithal to treat the major deformities allows me to do these operations in a more efficient manner, particularly the smaller surgeries. And those are still patients that make up the majority of my practice. I see all of my patients myself. I have a conversation with them, and then I take a step-by-step approach to tell them what the treatment algorithm is. A lot of the things that we see in the spine don't need surgery, but it's very difficult to determine if something needs surgery if you're not a surgeon. As a first visit, we're not quick to operate on somebody, but we're able to direct them in the right direction, send them to the appropriate doctors, such as a physiatrist, a pain doctor, so that they can get the treatment they need. And if all else fails and they go through the entire algorithm of the treatment, and if they need surgery, we're happy to operate on them, but we always use that and save that as a last resort.